Hello, everyone. I hope everyone can hear me. So I will be sharing my screen very soon. When I'm joining my screen, I'm sorry I will not be able to take any questions, but I will take questions at the end of my presentations. So give me a moment so I can share my screen. Okay, great. So this presentation is going to be about the ECFVG application guidelines, the pathway to be able to apply and get your certification for the ECFVG. These are my disclaimers. So I've been asked first to introduce myself, which is always, I find, the most difficult part. My name is Dr. Melanie de Schaatsen. I'm a Belgian equine veterinarian. I'm currently residing in Belgium. I have both nationalities, so I was born in the United States and I lived there until I was 18, and then I moved to Belgium to do my studies. I graduated from the University of Liège in 2005. Afterwards, I went to do my equine internship at the Royal Veterinary College, where I also did my 6-month small animal internship, which at that time was part of the ECFVG program certification. And I succeeded my certification and my NAVLE exam in 2007. I then stayed in England. I worked for 5 years in a private practice. And finally, I moved back to Belgium in 2010, and I developed my own private practice. And now I'm specialized in orthopedics and pre-purchase exam. I'm also one of the team vets for Belgium. Since 2015, I've been to many international competitions, and I was very lucky to participate in the WEG in 2018, in the World Championship in turning in 2022, and in both Olympic Games in Tokyo and in Paris. So enough about me. Let's get to the important stuff. So this is an overview of what I'll be talking with you guys today. So please bear in mind procedures can change over time, and you need to check for current updates on the AVMA websites. For the moment, for example, in order if you wanted to do your online application, they're doing some maintenance works on the website until the 21st of October. So you will not be able to access the online platform until that day. And there may be some changes after the 21st of October. So I'll just give you a basic idea of what is the ECFVG, who should apply, the 4 steps that are necessary in order to get the certification, an idea of timelines and total cost. And just to mention also, it's important that you know that once you get the ECFVG certification, that doesn't mean that you can directly go and work in the United States. You will also either have to pass the NAVLE or pass certain state exam in order to get your state licensure to be able to work there. So the ECFVG is it's an education commission for foreign veterinary graduate, and it's basically a certification that they have put together so that they can make sure your degree that you've received as a veterinarian is equivalent to what they had been teaching in American colleges. Who should apply? If you've graduated from an AVMA college, you don't need to apply, but that's mostly colleges that are in the United States or in Canada. The second situation is if you've graduated from a college that is listed in the AVMA and ECFVG college, you need to be graduated and be a veterinarian and have no restriction in your own country to practice to be able to apply. They have a list on the AVMA site, and I've included it here on this link, so you can check if your college is onto that list. And then the third scenario is if actually your college is not on that list. If your college is not on that list, you cannot apply to the ECFVG until your college appears on that list. And if you would like your college to appear on that list, you have to go through a certain process to do that, which is mentioned here into that link. And only once they've accepted the college to be on the list can you start the ECFVG steps of certification. So, step one. So in order to start step one, you will have to go online and you will have to complete an enrollment application. You go onto the AVMA website and then they send you to an online application. The fee for the first step is $1,400. So that includes $675 of application fee, which is not refundable, and also $725 quality assurance program fee, which is refundable within the first 60 days if you decide to withdraw from the application. After the 60 days, even if you decide to withdraw, you can no longer get that refunded. So there's going to be two pathways for the enrollment. Either if you are a graduated student, this is going to be the the pathway, and then I'll explain in my next slide if you're actually in your last year and going to be a graduate student. So only last years can still start the process. If you're not yet in your last year of graduation, you may not start the ECFVG process. So this page is if you graduated and you have your veterinary diploma. So they will ask you to submit a list of documentation. They have to be a little bit careful because they have to be received within 10 calendar days of the online application. So the ECFVG form, the online application that you will be filling out, that form needs to be notarized. You'll also need to have a photograph, which is of US standards. There is the guideline here in this link, but it needs to be recent, not older than 30 days. You will need to send a PDF of your diploma in the original language, as well as a certified English translation, and a PDF of your final transcripts of each year of study, as well in the language in which you have performed your degree, but also a certified English translation. They've put up a checklist of the documents that you need with some of the specificity, which I think is very handy. The link is found here. For the students that are in the last year, you will need to have so the same application on, sorry, I'm just gonna move my screen or else I can't see my, so you will also have to have a notarized ECFVG online application form, as well as the picture, a PDF of all your final transcript in the original language of each year of study, as well as a certified English translation. And then you would need to have a PDF letter in English from an official at your vet college, which will be stating that the applicant will graduate within the year. And you just have to be careful that that letter needs to be sent from the college directly to the ECFVG. So you cannot send it yourself. It needs to be sent directly to the ECFVG. And after graduation, then obviously you would need to send your PDF of your diploma with the certified English translation. So this is a link where you can find the checklist of the documentation, which I find is very handy. So once you have had those documentation sent in and you have had your online form notarized and they have accepted payment, then is the step one completed. So there's just a few pitfalls that I want to make sure I share with you so that you are attentive to. First of all, obviously make sure your college isn't to that AVMA ECVG list, because or else you're going to waste your time on doing the online application because they won't accept it. The documentation checklist is very handy. I would advise that first you check that documentation checklist, you get your diploma and your transcript certified English translation. And once you have all the documentation, you do start your online application and you fill in your online application, because once you fill in your online application, you only have 10 calendar days. So it's not even business days, but 10 calendar days to send the required documentation. And if the English translation takes longer than you expected, then you will have to go through the whole process of doing your online application. They have certain requirements as to the certified English translation, so please make sure you check before you ask someone to translate it, because they have special requirements for that. Make sure if you're paying by credit card that your credit card is activated for international payment to make sure that the transaction will go through. The AVMA has a recommendation to use Notary Cam, which is an online service for notarizing documents. They will ask you to notarize your online application, and so it can be quite handy to use that Notary Cam. And then usually, if you have all the necessary documents and the translation have been accepted, the approval of all the documents will take a few weeks. So only at this time, once they've accepted all your documentation and the payment has been processed and your credentials have been verified, you can go to step 2. So what is the step 2? The step 2 is the English language requirement. There are several that you can decide to do. There's also a minimum scoring that is related onto their website and to which ones is accepted. To be able to complete the step 2, you will need to pass the test, and then once you have your score, you will need to let ECVG verify the scores. And for that, you need to do a submission form, which I've added the link here. And once they have verified and accepted the scores, is the step 2 completed for the certification. In order to prepare for this test efficiently, I would advise you guys to go to YSEIS Academy to get some more information, and then they can help you out on to the requirements for this test. And then once this step 2 is completed, then we can go to the more difficult part, which is the step 3. So this is the basic and clinical science exam. It's a theoretical exam. You will know you are starting step 3 when you received either by email or on the online platform your authorization to test letter. So this is a letter that's important that has a code on it and your identification number. And with that letter, you will be able to take your test. The fee for this test is $220. It's for one test, it's non-refundable, and it's non-transferable. You can so in order to take this test, it's a computed examination, so which means that it's on a computer. You have to take it, you cannot take it online at home, you have to take it in offered Prometric test centers. So they have a lot of different test centers across the United States as well in Canada. They do also have some outside the United States, and they have a list of the accepted Prometric centers where you can take the test. The only thing you have to bear in mind is if you're taking it outside the US or Canada, then the fees of the test might be higher than the $220. So the test is a computed examination. It lasts for 220 minutes and you have 225 questions. It's a multiple choice. It can also be, there can also be some alternate format questions, for example, like matching or drag and drop. It's It's scored on only correct answers, meaning if you take the test and you're not sure of a response or you don't know the response, I would advise you guys to respond something anyways, because there will not be any negative points for wrong answers. I would advise you guys to carefully read the candidature bulletin, as in there's some more information in there. And in order to prepare yourself for this basic and clinical science exam, I would advise you to refer either to WISE IS Academy, which has made some study material for this test, or go on the AVMA reference study materials, where there's a list of books that can be necessary to prepare your exam. This is the content outline for this theoretical exam. So there will be 18 to 20 questions on anatomy. There will be 28 to 32 questions on pharmacology, physiology, and toxicology. 20 to 23 questions on pathology, 50 to 55 questions on medicine, 20 to 23 questions on anesthesia, 22 to 25 questions on surgery, 22 to 25 on diagnostics, 6 to 7 on animal welfare, and 14 to 15 on preventative medicine, making it a total of 225 questions. So this is just emphasis on the different domain of the test. So medicine will be carried out on 25% of the questions, and the rest are fairly equally redistributed. So some tips and pitfalls you guys need to be careful about. So as I had mentioned, the $220 fee is just for one test. So you only have one attempt to pass the test. If you fail the test, you can retake the test, but you need to wait for 4 months. So you can only pass the test 4 times in 12 months. And if you retake the test, you will have to pay the same fee again. Once you have applied for the basic clinical science examination, you have 365 days from the date of your application to take the test. Make sure that the name on your ATT letter matches exactly the one on your application form. And also, when you go to a Prometric Center, they will ask you to bring a primary and a secondary form of identity. So most of the time, the primary is your passport or your identity card. But your secondary form of identity can be, for example, a credit card. But on that credit card, you need to make sure that the name matches exactly that on your ATT letter and on your application, because or else they will not accept that as a form of verification, and then you might not be able to take the test at that time. So the test results usually are, you'll get your scores in about 20 business days, and they'll let you know either by email or on the online platform. The passing score is 580, and the way that it's calculated is that the questions that are administered to a scale that range from approximately 300 to beyond 900, and then they make a calculation of your score. And on that score, it needs to be above 580 to pass. So once you've passed this basic clinical science exam, then you can go on to the next step. So before going to your step 4, you will need to, in the documentation list that they request proof of surgical experience. You do not need to give that proof of surgical experience for step 1 when you give all the other documentation, but you are required to give this proof of surgical experience before you start your clinical proficiency examination. So before you do the step 4. your proof of surgical experience need to have been done within the 5 years prior to taking your clinical proficiency examination test. And it requires you to do at least one ovarian hysterectomy as a primary surgeon, and then at least 5 additional surgical procedures, either as a primary surgeon or as an assistant surgeon. You need to be careful that each documented surgery should involve all elements of an aseptic surgical procedures, including gowning and gloving, draping of the patient, and use of sterile instrument, because sometimes there can be some surgical procedures that do not require those steps, and if they do not require those steps, they are not considered as surgical procedures. And you need to fill out the form, which is on the link behind, and submit it before you apply for your clinical proficiency examination. So the CPE is a hands-on performance. So basically, it's a 3-day clinical skills examination where you will be asked, you will be put in a situation regarding 7 sections. I will come to them in just after the next slide. There's the most emphasis is on dog, cat, horse, and cow, but there is also some goats, sheep, and pigs. So you need to make sure that with all these species, you know how to handle them and you know how to treat them, and you have an idea of what their possible pathologies can be, because you will be noted not only on what the examination is on, but also on how you handle that specific species. You'll also be graded on your communication skills and service to clients. So you will be put in a situation as you're in a consultation and the person who's testing you is the potential client. I would advise you to read the entire candidate bulletin because that will give you enough more information on this examination. The fee is $7,630. There's a $7,430 CPE application fee and also $200 administrative fee. There's 2 approved sites, which is the Mississippi State University College and also the Vidicus Group, which has several locations. The score to be able to pass is you need to get 60 points out of 100 on all 7 sections. In the case where you would fail, there's 2 possibilities. Either if there's a fail in 4 or more sections, then you need to redo the full CPE and repay the full fee. If you only fail in 1 or 2 or 3 sections, then you have 6 months to retake the failed sections. You can attempt twice per section. The cost per section to redo it is $1,400 for the application fee plus a $50 administration fee. This is the format of the clinical proficiency examination. So the 7 sectors on which you will be examined is on anesthesia, on canine, equine practice, food animal practice, necropsy, radiographic positioning of the small animal medicine, and then surgery, especially canine ovarian hysterectomy. They've put out a clinical proficiency manual of administration, which will give you guidelines on what type of consultation they may ask. It describes specific section and skills that will be assessed. And they've also put out an example list of common diagnoses. So in that list, you will have an idea of what are the common diagnoses on which you may be asked, but it can be on other diagnoses that aren't necessarily into that list. And then once you've passed your CPE, then you have completed the step 4, and at that point, you should get your certification for the ECFVG. I'll give you a quick quick timeline on how long the process can take. This is very subjective because it depends the paperwork that you need and how quickly you can get the transcript or notarized, also how many times you need to pass or the clinical or the basic science theoretical exams. But this would be a guideline onto step 1 could take, a few weeks to 2 months, and step 2 can take 1 to 4 months, depending on when you get your English slot to pass your exam. Then step 3 is 3 to 6 months, and finally step 4 is 6 to 12 months. I've made these 2 slides just to talk a little bit more about the cost, just so that people can get an idea of how much the ECFVG certification will cost. So the first enrollment fee for step 1 is $1,400, and it's payable at the time of application. The English testability assessment, that will have different costs depending on which type of test that you would like to take, and depending also on the location that you will have to take. I would advise you to take contact with WISE Academy for the full procedures and for an idea of the cost. The basic clinical science examination is $220 per test that you take. If you do take it outside the US or Canada, there can be some additional fees. The CPE examination is $7,630. So in there's a $200 of administration fee and then a $7,430 CPE fee. You need to pay first $1,000 of CPE fee that is deposited at the time of application. And then you need to pay the remaining of the fee 60 days prior to your examination. And then you also have to bear in mind that there's the document verification costs, like the notary or the translation of your transcripts. There's also travel, lodging that you need to bear in mind as extra cost. They accept credit cards. You need to be a little bit careful that they will take your credit card number and then they will wait to get all the documentation, and then once notarized, then they will process the payment. But if there's a lap of 30 days between your submission and the notarized, and when they want to process the payment, you will have to resubmit the payment. They do not accept personal check, except if you have checks coming from a US bank. They accept cashier checks or money order. Most of the fees are non-refundable. The only refundable fee is the $725 Quality Assurance Program fee. That is only refundable if you withdraw your application within the first 30 days. And after that time, it's not refundable. You can re-register. So if the process has been taking longer for you to complete the 4 steps, you can re-register after 2 years. So your original registration is valid for 2 years, and after 2 years, you need to re-register and pay an extra $120. And in order to complete those 4 steps, you will have 7 years to complete those 4 steps. I've put here some QR codes that might be helpful for you guys, just to have a direct link of the AVMA website so that you can have some more information on there. And here are some useful links with some study materials if they can be handy to you. Great. So thank you very much for listening to me. I wish you good luck on this journey. I hope this was helpful, and I'm going to take some of your questions now.
Hi, Melanie. Can you hear me?
Yes, I can hear you. Hi.
Hi. My question is about the pattern that is going to be like in this entire course that you will be teaching, the course that will be taken by this academy. So, how is it going to be paced, and how the curriculum is going to be designed? And it is is it both for BCSE and NAVLE, or how is it going to be?
Yeah,
If you
I
can
think
clarify a few things.
sure. I think that's a question for Wise Academy. I think they're there, and if they want to answer themselves on the curricular activity, from my understanding, they're going to help you have lectures to prepare for the BCSE. And then afterwards, I think they might have at a later time a curriculum for the NAVLE exam. But the point at the beginning would be to help for first the English examination, and then in the second time to have the basic clinical science examination. So that would be a series of lectures that would be on topics that would be at the examination with, for example, some Q&As, answers as well, and to get you prepared for that test.
Okay, so in my case, I've already kind of completed step 1 and step 2, and I'm looking forward to like prepare for BCSE and continue with NABLE. So that's why I want some
Yeah,
clarity
okay.
if anybody
So
can
you've already
answer.
passed
Yeah.
you've passed also the clinical proficiency exam.
No, no, step 1, step 2. So
Step one,
that's
step
like
two.
my,
Okay, I
yeah,
understand.
step,
Yeah. Okay, perfect.
yeah.
Yeah. Yeah. Then I think that's what I don't know if they want to comment more on that, but that would be the point. That would be to have lectures to prepare you for the for the BCSE. So I don't think that they're going to make them both together. I think they're going to first
Okay.
concentrate on the basic clinical examination, and once those steps are passed, then to go on to the NAVLE. But first, the NAVLE, you first need to have your ECVG certification to be able to pass the NAVLE.
What I understand is once you complete your BCSE, you can go ahead like do your NAVLE, and
Exactly. Yeah,
then
exactly.
you can clear your CPE. So
Yeah,
that's what. Yeah.
yeah, exactly. So there's one question about can we get sponsorship after clearing BCSE and NAVLE for a temporary license? So that's something for those for the licensing that depends completely on which state you're going to be licensed, and that needs to be verified and cleared with each board state license, because there's too many states that have different procedures for that. Would you suggest ECVG or pay for recently graduated students? So here we're just talking. So the question is, ma'am, I don't know if you guys see the questions or not, but do you suggest ECVG or pay for recently graduated students? So that's very me. I didn't go through the PAVE. I went through the ECFVG. I think it depends what are your opportunity on getting on PAVE. You need to have some clinical proficiency examination. And I think Wise Academy will either next week or in a few weeks have a lecture on PAVE. And then it depends of your specific situation and the opportunities that you get to be able to go and complete or not PAVE. I know the CPE is not that easy and takes quite a lot of time, but I think it kind of depends on what situation you're on. So I just get another question here from I think it was regarding the sponsorship after clearing BCSE and NAVLE for temporary license, and I think, can you repeat? Suddenly lost the connection. So I was saying regarding that, you need to have contact directly with the state, with the board state licensure, because there's so many differences between the different licensure in each state. So that's not a question I can answer, because it depends in which state you would want to get your license, and that you would have to contact them directly. Sorry, so I see there's a question. Can we take the IELTS exam before applying ECVG, and if possible, what is the duration of validity of the score? So yes, you can, and the validity of the score, you would have to contact WISE Academy so that they could tell you that, or you would have to check on the website of the AVMA, because they have several English tests and they have different validity duration that I don't remember by heart all of them, so that you would need to check. But yes, you can take it before. So sorry, there's one more question. So if example, I apply in Missouri for temporary license and it gets approved, and also by luck, if there is vacancy in that state, would the employer like sponsor for a visa? So again, that was part in my disclaimer. I will not talk about immigration because that's something that is not, I cannot talk about because I have no idea. It's not my specialty. Especially with depending on who's governing the country at the present time. So I would just directly speak with this state license in Missouri, and then see if they would sponsor for visa. But I cannot answer that question. My apologies. Okay, so I think that's it. I don't know if someone has some more questions, but I think then we can probably wrap it up. If there's any more questions, you can direct them directly to the WISE IAS Academy. Thank you guys so much for having me today, and I hope I was helpful with clarifying some of the pathway for the ECFVG. All right. Thank you very much, everyone. Have a great day. Bye-bye.